There we go.
Hello.
Hi, Laurel. I'm Jeanice. It's so nice to meet you.
So nice to meet you too. So glad I get to talk to you today.
Yes, likewise. Thank you for carving out time in your schedule, and I'm glad we got connected. It was a busy weekend, I think, for everybody.
Yeah.
I don't remember the last weekend that wasn't busy, but yes, we had a volleyball tournament, so we just got back last night, so it was, woo!
I just got back in Germany yesterday I was in the States actually for 10 days. So I'm glad we had this scheduled. So I'm up and fighting jet lag and we're doing it. We're doing it.
All right. Thank you so much. Okay. So give us a little background about yourself.
My name is Laurel Proulx. I am a pelvic health physical therapist. I started off in orthopedics. So working with athletes was my jam, loved working with female athletes. And the first woman who kind of got me into this pelvic health world was someone with chronic pelvic pain who found us because she was recovering from a triathlon. And then as you build that trust, as you know, patients let you in on what else is going on with them. And so really let me in on how severely this was affecting her life. And I didn't know what resources to offer her. So I started going down that road of where we could really find her help, and then utilized her pelvic health physical therapist as a mentor to me to teach me what I could do to really screen women that I was seeing who may have these issues, what I could do from an orthopedic standpoint. And then I started going down that trail of pelvic floor training. So love treating women, still love treating athletes, and I like mixing the two. So now I am in a PhD program actually in Texas, in Texas.
At TWU?
Yes, at TWU.
Nice.
And looking at the muscular part of pelvic pain. And I've been studying that in active duty military women, which is a whole nother ball game, but it's been great. So.
Good. That's fantastic. Okay, so our topic today is pelvic pain or overactive pelvic floor muscles. Is it a tissue issue or what's going on? So let's just jump right into it.
Right. So I got this tissue issue when I was actually a student, and I kept asking my supervising physical therapist on clinical, but he doesn't have a sprain, but he doesn't, we were looking at a knee maybe, or I don't know, it was a joint. Doesn't have a sprain. He doesn't have a tear. So why does he have pain? And my mentor said, it's the tissue. It's a tissue issue. And it was the first time in my head that I was like, oh, there can just be tissue that is painful, that isn't functioning correctly anywhere in the body. And I think that we forget about that in the pelvis. Women go straight to their OB-GYN, as you should. I'm not saying we need to rule all of that out.
Make sure medically that you're fine.
Absolutely. So then once they rule out, maybe they do an ultrasound, there's no mass, there's no cysts. They maybe do a urine test, there's no infection. A pap smear, there's nothing going on there. Great, but then they're left with what now?
Yeah.
So what are we supposed to do? And what OB-GYNs are not trained in and what we are trained in is assessing the muscles of the pelvic floor. And so that's when the pass off happens from one provider to the other. And so just making sure that people know that that pass off is an option, and to ask for a referral to then go down what is causing this pain. And it probably is muscular or a layering of other things. Maybe you do have a diagnosis of endometriosis or interstitial cystitis, which is a painful bladder. It also means that with those people, the majority of those individuals have a pelvic floor dysfunction, meaning their pelvic floor is not working the way that it should. It's either underactive or overactive, causing pain, maybe causing urinary symptoms. And we can treat the endometriosis or the interstitial cystitis medically at the same time that we can treat the pelvic floor muscles.
So important.
So really treating both things so that we're catching it all and we're getting 100% of the symptoms rather than only treating 25, 50% of an issue for somebody.
Exactly. So that kind of segues into the next question. So what happens, so somebody had endometriosis or IC and they've gone through all the treatment, but the treatment for the diagnosis doesn't change the pain. So if someone's experiencing that, what would you recommend?
Right. So a full evaluation by a pelvic health physical therapist. And what we're going to be looking for is anything tender to the touch. I have my little model here.
Yes, we love models. So helpful.
So pelvic health PT, when you go for your first appointment, we're going to look exterior and see if there's anything discolored, any sensitivities that we can just look for. We're also just going to feel around the tissue. Light touch should not be sensitive around this area. So that's going to tell us a lot about what tissue is sensitive, maybe what nerves are irritated, is the tissue healthy? And then most pelvic health physical therapists do an intervaginal muscular assessment. So that's just one gloved finger with lubrication. We go intervaginally, and then I'll flip around here. Here are your beautiful little organs. We're just going to take those out. And we're going to feel all of these muscles from inside the vaginal wall. And what we should feel, like with any muscle, it should have a nice give and release, a nice little trampoline elastic. And I tell people, just like you can get knots in your upper trap and it can be sore. And when somebody comes up behind you and you're like, ooh, that's tender. Or maybe you just went on a long run and your quadricep, the front of your leg is sore. That can also happen to your pelvic floor. So we can assess which muscle maybe feels that way, and then start going down the road of why. So the overactive pelvic floor is getting a lot of hype these days because we're getting off that Kegels for Everyone train, which I love.
Right.
The pelvic floor should also be able to relax and release and lengthen, not just contract up. But what our job is to critically think through, why is this muscle overactive? And I mean, when I mean overactive, I just mean it's on all the time. And no muscle should be on to that amount all the time. It should be able to release, relax, and expand to go to the bathroom, to have sex, all the great things that have to happen in our pelvic floor.
Yes. Yes, I love it. Okay, so then how do tissue issues happen? So we understand that just saying the pelvic floor is overactive isn't enough. We need to dive in a little bit more.
Right. So another thing, if you get your pelvic health physical therapist, you go to your first assessment, and then you hear you've got an overactive pelvic floor, we're going to be working on that. Don't be afraid to ask why. And it may take a few sessions to figure that out. So it may be a few options or many options that your PT should be able to articulate to you, but there should be a path that we start to go down to treat one or a couple of things. So first thing for our new moms out there is scar tissue. So sometimes when we have a baby, we have some tearing right here through, and you can see, since the skin is not there, that these are a lot of important muscles. And so scar tissue does not act like normal muscles. It doesn't expand and contract normally. So there may be some sensitivity there due to scarring. There's also lots of nerves here. So scar tissue through here. Also, if we tip the pelvis up as if we're standing or sitting, our abdominal muscles run right around here and attach into the front of our pelvis. If you had a C-section or even a gallbladder removal, an appendix removal, those scars are all going to pull in different directions. And important nerves come from our back through all those abdominal muscles to reach our pelvic floor. And so if those nerves can't glide and slide like they need to through those muscles, then it can cause a little bit of pain. So a good assessment of how your tissue is moving, the mobility of your tissue. So we're not just talking like the mobility of your hips or the mobility of your spine, but actually feeling how the tissue may be restricted is important to see that that could be a cause of your pain, either from a tissue standpoint or because it's also stopping nerves from gliding and sliding like they need to.
Very nice. Good.
So we forget how that's all kind of, a lot lives in here that's important. Also hysterectomy, same thing. So even though people are saying, they went intervaginally and removed everything, the scar tissue is then inside here. So we can also feel for adhesion, scar tissue mobility through there.
Internally. Mm-hmm.
Internally, exactly. And what we don't want to take as an answer is, well, you just had a baby. Well, you just had surgery. Yes, time does make things better, but also intervening in a timely manner can save you a lot of pain and can keep pain from being acute post-surgical pain that we expect to turning into a chronic pain. And so that's when we want to get in there. We want to stop that pain before 3 months, keeping it going until 6 months. If you've had pain for that long, yes, there's some tissue involved, but then we're going to be treating the whole system because your body's now used to being in pain.
Right.
So really getting timely intervention on that and just not accepting that this is the way it's going to be now. That's great.
So for somebody that had a hysterectomy or any kind of abdominal surgery, you would recommend that if they're, like, what would you say? How soon would you want to see them in therapy?
Right. So if at all, I would love to see women pre-surgically, because we can give them some things to do at home by themselves when it may not be possible for them to come in. To get in, right. Also just how to care for that scar. But a couple weeks post-surgically, I think, is very appropriate to give them even how to get in and out of bed, how to go to the bathroom, do things that are going to support their healing and not put extra stress on that tissue or that area where you just had surgery. Is going to support, if we don't cause pain doing the simple things, then that pain won't get out of control. And then we can really start working on that scar as it matures. 4 to 6 to 8 weeks. We'll have different kind of strategies around that scar, teach you how to touch and feel the scar so you don't gain fear around that scar.
Right.
I talked to a lot of, I talked to a lot of moms who've had C-sections that I'm like, did you do scar massage? And they're like, I don't even want to look at it.
Yeah, and I don't even want to look at it. No,
right.
I pretend like it doesn't
acknowledge it. Exactly. So we like to build that bridge with a gentle hand that this is now a part of your body. You need to teach your brain where this is. Brain remapping sounds crazy, but it's a real thing that your brain really needs to learn now where this tissue is, that it's safe, that it's not painful, that it's a part of your body. And there are real changes that happen in your brain to keep those pain levels down. So that's a big part of it.
Excellent.
Yeah.
Good. Okay. So scar tissue and pelvic pain, and then we have other causes.
So we have other causes. Yeah. So let's go. So we have things that are attached to your hips are also going to be attached to your pelvic floor. So if you had a hip injury, if you're one of those people that every time you extend a leg, you get a nice hip clunk happening. Maybe you had a hip replacement. Know that if we're looking at our pelvis here, as I turn to the side, this is the cup where our leg bone sits in. And these are all of our glute muscles. Oh, perfect. Great. Yes. So all your glute muscles attach here, and you can see how close they are to the outlet of your pelvis. Yep. So if your two things seem to happen here, hip muscles that aren't working the best, aren't doing their job of stabilizing, controlling, then our pelvic floor takes over. And so our pelvic floor can, exactly. If one muscle isn't going to do the job, the next muscle is, and the next group of muscles is your pelvic floor. So getting a PT that's going to do a full assessment of your hip and maybe assign some hip strengthening while we work on the overactivity of your pelvic floor so that those muscles can switch roles. We want the hip muscles to be doing more work and the pelvic floor to be doing less work. The other thing that tends to happen is a lot of new moms or even weightlifters who do everything with their toes out. So if you look down, that new mom, pregnant waddle, toes out, powerlifting stance is the same, everything is toed out, then your butt muscles, your glutes are always shortened. As we rotate our legs out, those muscles are always shortened. So they're always shortening our pelvic floor muscles as well. Like we said, muscles should be able to go through a full length and contract. So if they're always contracted, if you think about carrying a heavy bag of groceries, and then as soon as you let the bag down, it's hard to release those muscles and it can get sore. They can't react in time. Yeah. All that good stuff.
And weak over, And
right, weak, right. Yeah. We're not working them in their full range of motion. That's a great point, that muscles can be shortened and weak at the same time. Definitely. So those are the two kind of things we look for, hip relationships. The other things is hormones and pelvic pain. So lovely, as we are women, we go through multiple hormonal fluctuations throughout our lives. Great part about being a woman. What no one tells us is how reliant our pelvic floor is on hormone regulation. So these muscles are especially sensitive to hormone regulation. And if we lose estrogen, as we do post-baby, as we do in menopause, this tissue can become fragile, it can become a little painful, and then we also decrease lubrication in here. So in that first assessment that we look at, we're looking for the tissue health. of the area. And you may hear the fancy word de-estrogenization, estrogenization.
Now say that really fast, 5
I
times,
can't,
right?
can't, nope, not gonna happen.
You did a good job though.
Yeah. And so what that means is it's just lacking the normal estrogen that we need to keep those muscles nice and plump.
Yeah.
And not fragile. So like we said, if we want to be able to kind of press in and get a good spring back of your tissue, plump, yeah. And we, and
That's
yeah.
Usually we don't want to say plump, but plump is good with our muscles.
A good plump pelvic floor is great. Love it.
Yes.
And so just speaking to your doctor about that you may need some local estrogen cream or treatment in that area can be very helpful in changing the tissue health of that area. Very different than a systemic estrogen treatment like taking a pill. It's a local cream, different side effects, different medical considerations. And so having that conversation with your doctor who feels comfortable prescribing that is important for every person. We may just suggest having that conversation or making a phone call to your physician if we think that that's a good idea.
Good.
And then of course, if anything is painful in that area, let's talk about that for a second. So if we have sensitive tissue or pain in the pelvic floor, then those muscles contract up to protect. So they're protecting everything. If you are afraid of something, if you have fear, anxiety, whatever it may be for, it doesn't have to be sexual in nature. Yeah. It could be anything. Those pelvic floor muscles contract up. And really, it's a nervous system, top-down approach to protect your body. And so there was a really cool study that was done in men and then women, and they put electrodes all over their body and showed them some threatening images. And with any threatening image, a woman, the first muscle to contract in protection was their pelvic floor. In men, it was like upper traps. So we have
like they're ready to
fight. Yeah. And we're like, protect our eggs. And so we just have naturally different ways of reacting to everyday stress, trauma, anxiety. And so when you see a pelvic health PT or outside of seeing a pelvic health PT, really being aware of when you may be clenching.
Yeah, so many people are doing it without even having that knowledge.
No awareness. So what I mean is if you feel like you're clenching your jaw, if you feel like you're clenching your butt cheeks, if you feel like your shoulders are up here, and you may not feel like it, but next time you are standing in line at the grocery store, waiting for something, not feeling patient about it, read an email that gives you anxiety about work, in a fight with your significant other, do a check-in head to toe and see where everything is resting, because you may be one of those people that rests in this position.
And what is your pelvic floor doing?
Right. And so it takes a lot of habit breaking to realize, and awareness to realize when that's happening. So what I recommend for people who have this overactive pelvic floor, we may be treating it with stretching, manual therapy intravaginally, but also with this body awareness of a top-down body check. Am I holding tension? How am I reacting to things? And then really honing in on a program for you of what you may need to do maybe at night, in the morning, to calm your entire nervous system. And when I say nervous system, I mean the very real physical nerves from your brain to your pelvic floor, not the, oh, you're just stressed out and that causes pain.
Yeah.
There's a very physical reaction to stress and anxiety, and pelvic pain is one of those. So we teach how to connect that and how to quiet everything.
Yes. Yeah. So then we just jump into the next question. So what can I do?
Right. So let's kind of go from with scar tissue. We're going to teach you how to do scar massage. And I think you have a video already of really good scar massage. Perfect. So going back to that video on your YouTube on scar massage, I think would be very helpful. But like we talked about earlier, let's say it's perineal. We start around the area first without touching if the scar or tear is here. And then we go beside the scar and kind of move back and forth, maybe up and down on the side. And then we go to the scar itself. And that changes maybe over many weeks as that scar heals and as your nervous system calms down, realizing that it's safe to touch. The first thing that we want to establish is that safety. I often recommend doing any scar massage in the most relaxed place in your house, when you're not worried about someone barging in the door. You don't feel like you have privacy to do, right? And it really allows your body to relax and make those changes. Yeah. What we're doing with scar massage is increasing good blood flow. Blood should be going in and out of the pelvis all the time. And with scars around there, blood often gets stagnant, heavy, causes some achiness. And then also, blood has waste products in it that we need to get out of there that can cause some pain. So any kind of massage is going to be good for that area, even if you don't feel like I'm not making a difference. Yeah, it does. It does make a difference.
That's good. Well, I would just add also, like, a lot of times I hear people trying to do perineal massage in the shower. And so that's not necessarily wrong, but it's not best. So I recommend that you really need to be in a relaxed position with leg support. Because even if you're lying on your back, but your legs are up, then
that pelvic floor is on.
Yeah, you're not really relaxed. So I love a bathtub that you can just relax your legs on the side, you're reclined, you have the warm water. So
I love that idea. That's a great point. Yes, you have to make sure that legs are relaxed. If legs aren't relaxed, then pelvic floor is not relaxed. Yeah. The other thing we talked about was the nerves coming out of our back into our pelvis. And so we do a lot of back mobility. So we want those nerves to be able to glide and slide and be happy. So yoga positions like cat-cow, I really love.
Love it.
Laying on one side and kind of opening your chest, open book. Any rotation is really good. If anything is painful, we want to not push into a painful range of motion, but just going right up to that. I tell people like a 2 or 3 of discomfort is okay if you're normally at a much higher level. And then we'll try to get that down to a 0 out of 10 pain. But any mobility and blood flow we can get to those nerves is great. Hip pain, we talked a little bit about. It's going to be very specific to what your individual hip issue is. But we may be doing glute strengthening exercises like bridges, lunges, building up to squats, building up to functional positioning, or whatever your goals are with pelvic pain should dictate your strengthening program. It may start very low level as we assess what's happening week to week with your pelvic floor and your pain, but then that should progress up to whatever you want to get back to doing, and that's going to be different for each person. The other thing, in my soapbox of all soapboxes, is hip mobility internally rotated, meaning a lot of times our knees are splayed. We can relax into that position. Thank you. Yes, with the hips. Okay. So hip internal rotation is if your kneecap is going to move. So
it doesn't do it.
It doesn't do it.
No.
It does all the other directions that our legs can't actually do.
I guess a little bit.
So that would be it. Is if your kneecap is rotating inward towards the middle of your body, that's internal rotation. If your kneecap is facing out like a clamshell, then that is external rotation. If your toes are in, internal. If your toes are out, external. A lot of times we give women deep breathing, perineal massage, all these things with their knees out, which is a great place to be able to relax and breathe deeply. But if someone is always toed out and always has these shortened muscles, then we want to also take their hip muscles into internal rotation. So the muscles back here close to your rectum and close to this tissue that is torn with a perineal tear or an episiotomy, all of that will be in slack as your toes are out, but then will be stretched and getting more range of motion as your toes are in. So I try to, and often when I'm measuring individuals' hip range of motion as a therapist and then do their intervaginal exam, the side that doesn't have great range of motion is also the side that's super tender. So we really want to give them hip mobility internally on both sides, on that side to get equal, and then also give them the breathing relaxation in whatever posture they're able to best access that for them. So hip mobility.
Excellent.
Internal rotation.
Yes. I love it.
hormones, we talked a little bit about asking for that prescription for estrogen. And then there's all kinds of different dietary stuff that you can do for hormones that is not my cup of tea, but I often refer to really great nutritionists, functional nutritionists that can really help hone in on things as we're working on pelvic pain and overall inflammation. I love working with nutritionists. If your tissue is very fragile from a hormone imbalance, and as we're working on that with your other providers, lubrication.
Yes.
Lubrication.
It's not you're not a failure if you use lubrication.
No. Why wouldn't you? Everyone use
Why
lubrication.
Not? Yes.
Yeah.
It just makes things glide better.
Yes, always. So we want to look for things that are not scented, colored, flavored. Want to be kind to our tissue there. Water-based, those sorts of things. And you can kind of play around with, a lot of pelvic health PTs have different samples of different kinds. If tissue is very sensitive, you may have some sensitivity to even like the safe, clean brands. Your body just may not like it.
Just experiment.
So don't be discouraged if you need to try a few different brands. Exactly. Also, just a personal massage with coconut oil or vitamin E oil to keep tissue hydrated and just keep it protected. If our own body isn't lubricating like it should, those tissues down there are mucosal, meaning they need some lubrication, moisture on them to keep them healthy. Just like the inside of our mouth, if we didn't have saliva, we would need to have other fluid in our mouth to protect that area.
Such a good example.
So making sure that women feel comfortable doing that themselves and realize they're not going to hurt anything. It's very safe. And it's, at this point, it's like a hygiene issue. We're just taking care of the tissue. It would be like changing a Band-Aid on your knee. It's something that we need to do to keep our tissue healthy.
I love it. Good.
And then our nervous system, the biggest, hardest thing. So, you know, we could talk about this as its own like weekend course.
I know.
But the easiest, most accessible thing to do to help calm our whole nervous system down. And when I say calm nervous system, I mean this fight or flight mode. So sometimes we get stuck in fight or flight, meaning our body thinks everything is an emergency. We need to protect our eggs. Everything is difficult. And we need to bring ourselves down to parasympathetic, which is our rest and digest. Bring our heart rate down, bring our hormonal stress levels down. It is all controlling things in our pelvic floor. So deep breathing sounds like the most simple thing, but it really is such a great intervention.
So good.
And so underrated. And I don't want any woman who has pelvic pain to think that they're being dismissed in the severity.
Just go breathe.
Exactly. In the severity of their symptoms because someone told them to deep breathe. It really is, as we do deep belly breaths, expand our ribs, expand our belly, our pelvic floor should also expand. So we're getting a good lengthening of that tissue that's overactive and angry and has all, you know, the different pH changes that are making things painful. We're just getting good expansion and good blood flow with breathing.
Yes.
And then the other thing is our vagus nerve, which runs from our brain through our diaphragm, is part of that fight or flight. And so by moving our diaphragm, we are helping calm down our fight or flight nervous system.
I love it.
And so what we've also realized in the research is that a lot of these pain things can maybe have an immune component. Maybe they come with different allergies, you have inflammation in other places, things that will be addressed by hopefully other providers. But the vagus nerve has this gut to brain relationship. And so if we can calm down the central nervous system, we're also calming down inflammation. We're also calming down this overreactive immune response. And so, like we said before, working with both ends of the symptoms, getting things medically treated, and then doing what we can from the muscle perspective to get all of the symptoms.
Yes. So helpful. These are such helpful tips. And I hope that, you know, anybody that has pelvic pain or that you know somebody that does, please share this information with them because there's hope. So many people have no idea that this exists.
Right. And that it's been their norm for too long, and they've dismissed that maybe they can't ride a bike anymore. Maybe they can't have pain-free sex anymore. All of these things that they've just taken off of their list, and because they've been cleared by a doctor, and know that there's so many different avenues. There's like 15 different names for different types of pelvic pain.
At least.
At least. And depending on the year, there's a new list that we all agreed on that comes out. And so know that what all of these have in common is pelvic floor dysfunction, meaning these pelvic floor muscles are overactive, maybe weak, not responding the way we want to, and are painful. And so no matter what your title is of pelvic pain, there's something that can be done to the muscles involved.
Yes, yes, yes. Okay, so now let's talk a little bit more about you. Do you have an online program? How can people find you? I want you to give yourself some shout outs here.
Yes, so I'm in Germany. I'm an American living in Germany. So the time difference is a little crazy, but I do take telehealth online clients.
Okay.
I have licenses in Texas, Missouri, Tennessee, and Oregon. So if you're in those spaces, we can do, real physical therapy. Otherwise, I love doing consultations to just answer your questions and have you find the right people. I think telehealth is best utilized as education. And then I don't think real pelvic floor PT can be done online. I will not ask you to show me your vagina. It's a lot of education, exercise resources. I love working with individuals after maybe they've worked with their pelvic health PT to become pain-free or continent, and then kind of boosting up their program to get back to, I have a lot of aerialists, like circus artists that I love working with. So my website is femunfolding.com. You can schedule there. My Instagram is fem.unfolding, and you can schedule through the link there. And then I have a program coming out this winter. I don't know when yet. We're putting a lot of work into it.
Oh, I know.
To help women in a comprehensive manner recover from childbirth. So it's going to be great. It's going to have a fitness component, but a lot of education about what pelvic pain is, what prolapse is, what incontinence is, so that I hate to hear women say, why didn't anyone tell me?
Yes.
Why didn't anyone tell me? And that's my kind of phrase that keeps driving me to provide this free education.
Yeah, no one told me.
No one told me. Right. And there is something that could have been done about it earlier if I just would have known.
Yes.
So it's going to be, that's what's taking me so long, is because I just don't want to short women on the education that they need. And I also need to realize that I can't teach everything.
You have to balance life. Life still goes on, and you're trying to do all these things. So I totally get it. Good. Well, we are looking forward to that.
Thanks.
And so this will be on YouTube, and we'll have the links for your website in the YouTube caption.
Perfect. Thank you.
My pelvic floor muscles, no spaces. Thank you so much, Laurel, for joining us. Thank you, everybody here that joined us. We really appreciate your time. Thank you for all your expertise.
Thank you so much. Thanks for your time. It's been really fun.
Yes. All right. Take care. Have a good day. Bye-bye.